Welcome to this video legislative update for the Medical Society of Delaware. I'm Dr. Richard Henderson, Chair of the Government Affairs Committee for the Medical Society of Delaware. Our goal with this video is to keep our membership and our friends informed of two important things. One is the legislative and regulatory issues that impact our profession of medicine in the state of Delaware, and two, the efforts of your medical society to address these issues. Despite having a serious financial and budgetary issues this year, the legislature was very active when it came to healthcare-related issues in the field of medicine. This first session of the 148th General Assembly adjourned at 5 a.m. on Wednesday, July the 1st, 2015, after the legislatures dealt with a very difficult budget scenario and passed a capital budget totaling $456 million. Throughout this past session, the Medical Society of Delaware was extremely active on a wide variety of issues of interest to the physician community and our patients. A comprehensive recap of the bills we followed and worked on is available on the Medical Society of Delaware website. Here's a brief highlight of many of the bills that held our attention during this session, and we'll begin in the Senate. One item of particular interest to the Medical Society was Senate Bill 101, which was introduced by the Delaware Advanced Practice Registered Nurses, or APRNs. Following a national blueprint for an interstate licensure compact for APRNs, Senate Bill 101 was seeking uniformity in the interstate nursing compact, revision of current collaborative agreement arrangements, streamlining of Board of Nursing actions, and independent practice. The Medical Society and the Primary Care Specialties Societies engaged with the bill sponsors and stakeholders to negotiate safeguards and quality metrics to make sure that patient safety was always the top priority. When Senate Bill 101 was originally presented, the Medical Society was strongly opposed. Then, after what had been an active and inclusive process over many months of dialogue and seeking input from our Government Affairs Committee and other societies, we were successful in advocating for the inclusion of many substantial patient safeguards. The Division of Professional Regulations and the Board of Medical License and Discipline also reviewed the bill, and their concerns regarding patient safety were addressed with additional changes. The changes and safeguards that were part of the ongoing conversation were included in the Senate substitute bill, which included the following: creating and empowering an APRN committee, which will be composed of 4 physicians, 4 APRNs, and 1 pharmacist, who will draft regulations regarding safeguards, educational and performance metrics for APRNs both in and out of independent practice. Requiring that a collaborative agreement still be used for a mandatory period of 2 years and a minimum of 4,000 hours in the area of foci in which the APRN seeks to practice. This will apply to both new APRN graduates and those who would seek transition from independent practice outside of their current practice arrangement. The APRN committee will review collaborative practice experience of all candidates seeking independent practice and determine if this privilege is granted. Defining independent practice settings and protecting the standard of care by requiring an APRN who practices independently to be held as the same standard as a physician. Any reported breach of a standard of care by an APRN must be evaluated by the Board of Medical Licensure and Discipline. And finally, establishes a sunset provision for review of this legislation in 4 years. Senate Bill 37 was Senate Amendment Number 3. This bill requires a mammography service provider to provide specific notice to a patient if the patient has dense breast tissue. This was another bill that took some time to resolve. Initially, the bill was very prescriptive on the language that a doctor had to use when a patient was identified as having dense breast tissue. This language was removed and replaced with verbiage that was more educational and consistent with local and national best practices and guidelines. Senate Bill 90 was Senate Amendment Number 2, or Riley's Law. This adds intractable epilepsy to the list of debilitating medical conditions for which a physician may supply a written certification for medical marijuana. It also specifically adds disorders such as dystonia to this list. Senate Bill 143. This bill sought to expand the scope of practice of optometrists to include performing surgery, as well as expanded pharmacology, including controlled substances. This bill was introduced late in the session, and after considerable discussion between the optometrists, the Delaware Academy of Ophthalmologists, and the Medical Society of Delaware, the Medical Society, along with the Delaware Academy of Ophthalmologists, voiced strong opposition. As a result, the bill and the issue will be taken up by the Sunset Review Committee in the 2016 session. In the House, the following bills were followed. House Bill 5 with House Amendment Number 4. This adds electronic smoking devices to the Clean Indoor Act and prohibits the use of electronic smoking devices in all public places where smoking is prohibited under current law. House Bill 69 with House Amendment Number 1 and Senate Amendment Number 1, better known as the Telemedicine Bill. The advancements and continued development of medical and communication technology have had a profound impact on the practice of medicine and offers opportunities for improving the delivery and accessibility of healthcare in and across the many professions responsible for the well-being of Delawareans. Telemedicine is such a technology and such an opportunity. This bill also creates payment parity for service provided through telemedicine services. House Bill 64. This act authorizes the use of medical orders for the scope of treatment in Delaware and is called the DMOST form. It will allow Delawareans to plan ahead for healthcare decisions, express their wishes in writing, which will both enable and obligate healthcare professionals to act in accordance with the patient's expressed preferences. The statute authorizes a medical order which is transportable, standardized, and implements a patient's end-of-life preferences. House Bill 70 with House Amendment Number 1 and Senate Amendment Number 2. After nearly 2 years of meeting and negotiations, this bill creates two types of licensure for the newly created Midwifery Advisory Council: licensed certified professional midwives and licensed certified midwives. The bill clarifies that a licensee of the same licensure type should serve on a panel conducting any disciplinary hearings or temporary suspension hearings of a licensee. It also clarifies that the council will promulgate regulations governing the scope of practice for each licensure type with the approval of the Board of Medical Licensure and Discipline, and indicates that a preference that the 4 Midwifery Council members consist of 2 members of each licensure type whenever possible. This bill also includes clear language that women with high-risk pregnancies or high-risk conditions would not be candidates for home birth services. Also, the bill requires that when minors are treated by midwives licensed under this chapter, they are provided with safeguards in similar sections of the Delaware Code, such as for nurses, chiropractors, and physical therapists. There is also revocation of a license upon conviction of a felony sexual offense and disqualification from licensure for someone convicted of a felony sexual offense. House Bill 139 with House Amendment Number 1. This act provides for prudent flexibility in the ownership of professional corporations, in particular as it relates to certain medical professions, and is intended to promote synergies in the delivery of healthcare statewide as professional corporations expand their existing ownership to collaborate with those contemporary professions permitted under the Act, and specifically defined therein as qualified related professional services. In addition, this bill addresses long overdue technical corrections to the Professional Services Corporation Act in Delaware, which has not been substantially updated since it was enacted in 1969. And finally, House Bill 150, or the bill to allow physician-assisted suicide. This bill was tabled in committee after the Medical Society and other groups spoke out in strong opposition. We do expect that this bill will return in the January 2016 session of the legislature, and we will remain opposed to any other legislation involving physician-assisted suicide. Thank you very much for this opportunity. I'd also like to thank the members of our Government Affairs Committee for their time and expertise this past legislative session, as well as the staff of the Medical Society of Delaware, who have been absolutely invaluable in helping us perform our activities. Have a great day.